Welcome to our March session of Community Health Learning Collective. If you have not already, please introduce yourself in the chat. This is a group for and by community health workers, Promotoras de Salud, CHRs, but also anyone, personally or professionally, who cares about the health of communities. So we're excited that you're here, and we're so excited to have Margarita Reina, who is a senior epidemiologist at the Chicago Department of Public Health. And she is a real advocate for sort of bringing data to the people and empowering people in communities to understand why data matters. And so I'm excited to learn from her today. Take it away, Margarita.
I'm so happy to be here. Maureen and I met through another really wonderful group of people called the Chicago Vaccine Partnership. Like 3 years ago, well, like 2 years ago, I met. When we were rolling out the vaccine, I was doing a lot of community engagement and data capacity building, and presented every week to this group. And I met wonderful people who I still work with. And Maureen has just been a wonderful support of the work that we do here. I am at the health department. I've been here since 1999, but I've been in public health since 1993. So it'll be 30 years in September. It's a long time. So, but I'm very passionate about the work that I do, especially with folks like yourselves, because this is where things happen. Oftentimes people forget, even in public health, that that's about the data and the policy and of course the vaccines and everything like that. But if you don't have trusted relationships, then the vaccine's not gonna be taken into arms, right? So we have a lot of powerful messaging. So there's wonderful things that you could do without taking any medication, drinking water and sleeping and talking to your family, like all these things. But if we have like what we had for the COVID pandemic, we have these wonderful vaccines and treatments. But if folks are not really believing the government and so we sometimes are faced with folks that are not trusting and therefore not getting these vaccines, and a lot of times these folks are actually dying because this is very serious, and we are still seeing about 10 deaths from COVID every week in the city of Chicago, even though COVID's sort of like over, but it's over. There's plenty of vaccines. There's bivalent boosters. Everyone from 6 months of age and up are eligible for vaccines, but we're still not getting everyone on board. So for me, the most passionate and most rewarding thing that I do is like actually do presentations and train folks like yourself. So I'm so happy that you've invited me. So I'm going to sort of give you a glimpse of what it is, the Data Academy, and how
You already know I'm just going to say that.
and how I train folks like yourself to learn where the data is, how to tell your story, and to really move your communities and not just your communities, but like I have found that it's like an agent for change at the personal level. So folks that have gone through the Data Academy that I've done have told me that they've gotten promotions, that they've maybe started their own business, they have some agency and unrealized power in them that they could, tell their story, and like maybe where they are in their professional world is not where they want to be. And I just love that. Like I love those success stories. So I will give you I'll put my email, but I think it's it's in the email, my email and my phone number. But it's really about you all and what you need. The way I do epidemiology is, of course, I know how to make maps and charts and analyze and do multi-level modeling and look at unemployment or health insurance coverage and poverty and everything and sort of figure out what's missing. But really, it's these connections with real people. And if I'm not producing the data that is going to be seen by folks like yourselves, then it's not going to move things into action. So please stop me along the way. So I'm going to give through like sort of the history of where the Data Academy came from, but then we're actually going to learn some things. So it's kind of like a very mini like Data Academy little teaser. So hold on. Why is this not working? Okay, so this slide, which I just did a few months ago when I presented to the Board of Health here at the Health Department, and somebody asked me recently, I think like November, December, like, why did I do this? And like, why do I, like people have asked me during COVID, it's like, as an epidemiologist, you really like to talk to people and like you do a lot of community engagement and how did I do this? So it wasn't something that I learned at school. I guess it was something like in me and this is my passion. So I'm going to sort of take you through, somebody told me to put this like in chronological order. So I mentioned to you that 1993 was a big year, not just that I started in public health professionally as a caseworker for Cook County Department of Public Health in the Northwest suburbs. But I actually am a gun violence survivor and actually was shot 5 times when I was studying in Colombia. And I'm a dual citizen with Colombia. I was born in Chicago, but my parents both were born in Colombia and they moved here and then got married and I was born in Chicago. I went to Colombia to do graduate work in political history and I was 22 when I went there. I had dual citizenship. I was working in starting my PhD work, and on spring break around this time, it would be April 3rd, 1993. We were attacked. The car that I was in was attacked by like 12 to 15 people with guns, and I was shot 5 times, and I was in a coma for 6 days, and I actually lost my ability to speak, read, or write for a couple of months. I am just a miracle that I'm actually alive. So um, I didn't realize, I know that you all do this like heavy work and the work that you do, especially in hospice and as you're working this community health worker, you understand the trauma and what is going on with folks that you work with, but this is a real thing, right? And so I had this drive to be purposeful in my work. I mean, I did that before, I had this horrible like incident, but more so after it happened. So I started volunteering. I was volunteering before with the public health department in the Northwest suburbs at Cook County with the CAPS program. I worked as sort of a community representative for the Latino Advisory Council to figure out ways to improve access for the Latino population in the Northwest suburbs. I love my role as a caseworker for Healthy Moms, Healthy Kids, where I met and helped with pregnant or postpartum women accessing care. But then I quickly was like, okay, I really want to work in Chicago. So I worked in Erie Family Health Center as case management coordinator, where I was the helping the case managers with outpatient treatment for mothers who were in recovery, hopefully to keep custody of their children. All of them were mandated to do this outpatient drug treatment program. And it was a phenomenal, I think it's the best learning experience that I've had to date in public health, because I really listened to the stories of these women. And at 24 years of age, I was like, I didn't have like that. I didn't really understand what it could be like for women in this situation. And so sometimes folks like, judge, why would somebody that's pregnant be on heroin or crack or LSD, like whatever. And when you understand these stories, you understand that it's an environment where folks are in, that maybe a lot of, I know you guys know a lot of the ACEs study, like adverse childhood experiences, like a lot of these women, all of these women had histories of sexual violence, physical violence, somebody in their family died suddenly, or the somebody was incarcerated, like, and there's like a lot, it's like multitudes of things. And so then you realize it's not like a quick fix, like, oh yeah, that's just not a good idea, you're pregnant, and and so it was really, how do we do this in public health? How do we change the environment? And right away I knew that I needed to finish like my studies, and I went from like studying, wanted to be a professor in political history, but which I love, like teaching and stuff. But then I went to study public health, and I went to UIC. Originally, I did community health, but then I was really challenged by epidemiology and like merging those like data driven approaches to like what works in communities. And at that time, there really wasn't a social epidemiology, but that's kind of what I am. So I did that. And then I got promoted. Well, I went to the health department, I worked in HIV, then I worked in mother to baby transmission of HIV. I mean, a maternal child health epidemiologist at the health department. Then I started my PhD at UIC. I didn't yet finish, and then I became a TB epidemiologist. And then I started really my role in 2014 here is my role to be a social epidemiologist. This is the first time that the health department actually has like a social epidemiologist, and that's what I do. But I didn't have the training for it like way back in the 90s, but that's what I do. The person who I followed here, his name's Steve Whitman, and he had passed away in actually 2015. But he was a professor of mine in the 90s, and I wanted to work with him. But as soon as I got here, a few months later, he actually started I'm sure you know about it, the Suhi Sinai Urban Health Institute in 2000. And so he has just been like, now they celebrated already like what, 20 years or more, right? So they have this amazing way to do epidemiology, like really centered for communities. So I try to do that at the health department, and whatever way I can, I lead with people. Right. So I work on Vision Zero, eliminating traffic fatalities, Elevate Chicago, where it's equitable transit oriented development, place-based epidemiology, where we're looking to see like what is the effect of things that are going to, like the 606, like the trail, or how do investments affect the health of the community. So I work very closely with our Healthy Chicago, of course, 2.0, violence and injury prevention, community development, and most recently, the Healthy Chicago 2025. I co-led the community capacity and youth leadership work group. I worked on the racial equity rapid response with COVID, on the steering committee and the data working group, and the Protect Chicago, which led me to meet Maureen in the vaccine partnership. And I still do that work with Protect Chicago and give data that matters to communities that want to prioritize the resources in a way that's equitable. And I always ask folks, what is it that you need answered? What is the data that you want to tell your message, right? Because they're more willing to listen to people they trust. So people who listen to my message, like Maureen, are going to say, oh, I found this data out, and here's this map, and that could help you. But you know what? And then somebody will tell Maureen, like, hey, I don't know what's happening with mental health. Like, I'm having trouble accessing stuff. And then Maureen might come to me and say, hey, Margarita, like, what is going on with mental health? And I was like, oh, I'm working on this map to let people know. And I'm going to talk about it today, about the Unspoken website, about you going in and putting in your address and finding mental health resources there. So it's all like this feedback loop of making sure that we are reaching folks, and especially you all, because you are the conduit to the community, and you're folks that are going to make this happen. So hopefully that was not too drawn out, but people always ask me sort of like, how did I get here? And I also want to, part of my Data Academy on the fellows is I want them to sort of understand their purpose, right? It's always more meaningful if people work on things that are really passionate about, and then sometimes they're not sure what it is, and then it's just like asking questions. So like I said, I lead the place-based epidemiology inside the health department. So that's like, how do we work on equity and make how to build in racial equity and health equity into the work we do. So this was like before COVID, gosh, maybe like 2017 or 2016, 17. We at the Office of Epidemiology, where I just currently came from. Now I'm in the Behavioral Health Bureau, but it's kind of all the same, but slightly different. We were really thinking about how we do our work. And we realize in the statement, like, in order to truly understand community determinants of health, because we're all talking about social determinants of health and all these hot topics by the CDC, and what really matters is the root causes and education and housing and all this stuff that really, really matters, right? So in order to understand this, we had to really change, epidemiologists had to change and examine how we did what we do, like our practice. So instead of just using like this raw data, whatever it was, like unemployment or birth outcomes or deaths and homicides, we really needed to shape it in the way that it was going to change the outcome, because we've been doing this work for so long, and we can see the same maps. Like, I can show you the same maps from 1990 for infant mortality or homicide or even opioid over. It's the same map, right? So, and we're talking about racial equity, talking about root causes, but unless we're going to actually move on those things, it's going to be the same outcome. So that means that we have to involve people in the decision making. So this was actually very exciting. So with the rollout of like the RERT, this happened in 2021 from COVID. Well, COVID started, well, in early 2020, but one might say like in the end of 19, but very soon after the COVID started in April, early April, the Mayor Lightfoot's mayor's office decided to have this racial equity rapid response team, and in that, the Protect Chicago, where we really looked at data to drive resources to the most impacted communities. And those were predominantly like the Northwest side, obviously the Southwest and the near South. I'm not going to ignore the West, but there's a lot of on the West, but not as much, because we know that the folks that really had to work on the front lines, that were essential workers, were really hardest hit during the first part of COVID, because we didn't have vaccine at that point, right? So on the West side is where we saw a lot of and the South side, unfortunately, the coverage rates of the vaccines were very, very low, because that's like another part of it. But at the very beginning, the RERT was set up, and I gave them, the data to help prioritize those resources. But also we did what we hadn't done at the health department before, is we actually fund agencies to do their own work. So it's kind of like these little health departments, these community health. So we split them up into like 6 regions. So each one of these regions has a regional lead. They had to apply for this as an RFP. So they had applied to be a regional lead. And then there's these community areas. So there's not every community area has a representative, but there are many that do. So also it's subcontracted from the regional lead. So then they find community leads to do that work. So we did this work in the beginning of 2021, and they were funded in May or June. And I was a community lead trying to get those vaccine clinics at the community uh, created with jointly with the regional leads and community leads. So for example, I was on the northwest, and the north central, the community lead. And I met with, for example, folks from Belmont Cragen, from the Northwest Side Housing Center. So we met with the 36th Ward Alderman that was also very engaged in Belmont Cragen, and we were strategizing on how to put up a clinic that people would feel comfortable going to. And they decided that they wanted that clinic to be at the Bricktown Mall. I was like, oh, that's cool, right? Because it was a place, this was in the summertime of 2021. It was a place where people had to go. There was a Target, there was this unique it's called Unique store. It's like a discount store. And so there's like a lot of things in this Bricktown Mall that people had to go. And so if they were going to go there, they might as well get a vaccine. And the alderman's office actually moved in July 1st to that mall. So their offices moved onto the mall. So it was kind of like a perfect, a scenario. And so we started having these clinics there, and they were very successful. We had one on Mondays and then on Saturdays. So we had Mondays and Saturdays. That went all the way until like 2022, like January. I mean, it was like amazing. Belmont Cragen turned out to be the highest coverage of any community area in the state of Chicago. It was amazing. And I say that's because it was really community led. It was authentically done the way they wanted to do it, right? So that being said, we did this in all the communities. Some were more successful than others. And at the end of the summer, I was asked by the deputy to design sort of a data capacity for these regional leads and community leads who I had been working with anyway. And so, but because I was only working with some of them, she asked me to do all of them, right? So I was, okay. So I created this data academy, which I'm going to talk to you about. So when I did this, I had just recently was selected to be in the Latino Caucus Leadership Academy in October of 2021. So it was like exactly the same time. I was asked to do something and I got accepted to do something else. And then I'm like, oh, the thing that I'm doing, right? That's kind of like this executive leadership thing. I was like, why don't I just make that for that? So I just like created this academy that I did. But then I found a lot of presenters. It has more than 20 or 30 presenters, both from the universities, physicians, attorneys, community stakeholders. I mean, it was I can't be prouder of this work. And I'm doing this again in year 2, actually starting in April 14th. And I'm so excited that we got this. It's going to be in person. And the first meeting is going to be at the Hatchery, which I don't know if you guys know. The Hatchery is like amazing space that is community centered, where folks can use the space of kitchens to like start their own business. It's all about entrepreneurship on the West Side. It's amazing. So they've been really wonderful partners. So I'll explain to you like how my idea of it. So each of the regional leads, of course I have regional leads, each of the regional leads had a fellow from the regional lead organization. And then I had 2 or 3 fellows from community leads from also the organization. So each region had about 2 to 3 people. in the Data Academy. So with about 20, we started about 25, but not all of them finished because some of them actually left their organization in the middle and couldn't finish. But we finished with 21 Data Academy fellows with a graduation in June of last year that was in person. And I tell you about that in a second. So these are sort of the objective of the Data Academy that we had. So to access hyperlocal data, and you're going to get a snapshot at that, how to use data to prioritize resources, how to effectively communicate data finding. And this is key. People know their story. People know what their community needs. But sometimes the story could be much stronger if they use data, relevant data. And so I show them how to use relevant data, but also the messaging has to be very clear and concise and in this sort of public health-ish kind of format, right? If they're going to live and try to get funding and resources in public health, they need to talk the talk of public health, right? So I brought in PIO, public information officers from the health department, from the mayor's office, elected officials, folks that knew how to do this. And that was one seminar on policy development and communication that was kind of awesome, that helped the fellows know how to present like data. And then also how to learn how to write research questions. And this is even tricky for epidemiologists at the health department, right? So epidemiologists at the health department, we generally don't do like manuscripts. I've been on several manuscripts because I've partnered with Northwestern and Lori's, but I let them kind of do most of it, and I have ideas, and I'm a co-author on it. But to be honest, we actually are serving the people of Chicago, right? So if people need data on obesity rates or on homicide or traffic, fatalities, like that's what we do. So I kind of like baby epidemiology. I mean, it's all a lot of like we're counting different things. I mean, that's really important, but we're not doing research stuff. I mean, we're not designing like, what's it called? Like what, Pfizer does to develop a vaccine. Like we're not doing this randomized trials. And no, that's not what we're about. We're about really meeting the needs of the communities so that they could improve their health, right? And looking at ways that, where are the gaps and how can we do things better, right? So research questions is tricky to actually teach because we don't do it ourselves. But I think I say research questions because I want people to understand what it is to be able to have a problem statement and what is it that they're trying to solve. So we call it research questions, but it's not, it's not like a PhD or anything like that, right? So what's the problem area? And it could be, better understanding of obesity among young people, 13 to 24 or something like that, or like understanding the SNAP benefit, like who's accessing SNAP benefits with respect to diabetes, or just like kind of understanding what's going on, right? And then to find the data to sort of flesh out sort of this like scientific method. So you have a problem, and then you get the data, and then you're telling your story, and then you have these outcomes, right? So so that's what they learned in this 6-month Data Academy. We had 5 90-minute Zoom sessions because COVID transmission was quite high at the start. Do you remember about a year ago, like January, February, that it was really, really bad. So we decided to do Zoom sessions, which were fine. And then we had 1 hour office hours that I answered a lot of questions, and people would show up, and I was really surprised. A lot of people, we had about 21 people, 5 or 6 came in, different people at every office hours. And then we have final presentation, in-person presentation to our city leaders. And each group had 10 minutes with PowerPoint presentation to talk about their research question, the data supporting it that from the Health Atlas, and then and the interventions or solutions for that issue area. It was amazing. So this is our schedule from last year. June 10th was the graduation. And this is what we talked about in the different sessions. So these are the 5 sessions. The first part, we talked about sort of getting to know each other and sort of leading in on each other, understanding equity, kind of what I'm talking to you about, and then a brief overview of the Chicago Health Atlas and the COVID dashboard, of which I'm going to go over today. So you guys are going to kind of get this a little bit. Then we sort of talked about a lot of other ways that there is data. The Census Bureau has a ton of data that the health department uses for the population and any number of, poverty, housing, education, unemployment. We use the census data that is populated in the Chicago Health Atlas. We also use Esri story maps and community engagement for data dissemination. We also talked about the Healthy Chicago survey. And then I have folks, this attorney I work with from Legal Aid Foundation and Cook County Health and Human Services. We talked about a medical legal partnership where we went really at the local level in back of the yards in East Garfield Park to really find out what the needs were from these communities and the data-driven approaches within the sort of asset-based perspective. We talked about the final project. We talked about violence and opioid overdose deaths. We had a community spotlight from a mother who lost her son to gun violence, who's working with Moms Demand Action. We had a sergeant who is now a lieutenant in community policing, talk about the successful relationship in community policing. We had some folks from COPA talk to folks about how you could give the COPA information at the local level, because some folks don't know how to access that. And then the 5th one I talked about, which is messaging and policy development. So I had 2 elected officials and a communications person do that. We talked about civic engagement, participatory budgeting, and youth councils. So that was a lot. This year, I wanted to do it in person. So we're going to have 4, maybe 5 sessions are going to be from 8:30 to 2. Like I said, the first one's going to be on the west side. This is the final project, which is a 10-minute presentation. And I had sort of it spaced out. I didn't want people to wait till the last second. So I asked for the research questions way ahead, and I had them turn it in. I had them turn in sort of the PowerPoint slides a week ahead. And that was challenging, but I had, I actually went out in person in June and had I was there in person to have folks give me their presentation before they gave it in the final graduation. So that went over really well. I want to say that we've done a lot of work at the health department to really do community engagement in an authentic way. We haven't reached, the pinnacle of community engagement, which is really over here on the right, which is empowering, giving community members decision-making authority over their program and services. But we have done it a little bit with HCZs or whenever we are co-leading this initiative. And we do it a lot more than we used to. So that is what I try to be involved in, building and sustaining those relationships and communities, and as often as I can. This is more difficult during COVID, but before COVID, I would always hold meetings in communities, and as opposed to having folks travel to the loop and things like that. And then listen. But I've been talking. So I'm really excited to hear. I guess we can just pause here, and I have a lot more to teach, which is now I'm really excited to find out where you all, what like your interests are. So if I'm excited about take yourself off mute and tell me about the interests. I don't want to assume that everyone's in the sort of the same space, right? So some of you are in hospice, some of you are community health workers in different spaces. So I would just love to find out, unless so Maureen or Kim, that you guys know what the audience is.
Yeah, so I'm sure Maureen and Kim have lots of ideas, but our audience, I think contains a lot of community health workers doing a wide range of activities, whether that's resource navigation or case management in different spaces. So I think in addition to that, we all come from communities, right? And we know what are important issues in our communities. So if anyone does want to unmute and share something that they're passionate about, an issue that they would like to figure out, how can I use data to fight for change on this issue? Feel free.
If not, it's okay. Some people are shy. I don't know. It's okay. I'm not seeing the chat, so I don't know if there's something in the chat.
Am trying to find resources for, and mainly it's housing. And I was wondering if you have any data about the best resources patients can. So I work at Swedish Hospital. I'm a social determinants of health case manager here. And I'm assisting patients with like 4 main areas, which are housing, financial hardship, transportation, and food insecurity. And food insecurity is pretty big in this north area, but also there's a lot of financial issues, and a lot of times it's rent. Like a lot of people are just struggling with rent payments. It's not necessarily always enough for them to apply for like a benefit, or if there is an opportunity. I'm just having a lot of trouble finding what the best resource would be for patients that are struggling with their rent.
Okay. How do you pronounce your name?
Nita.
Nita? Nita? No?
Nita, yes, you're right.
Nita. Okay. So this is exciting because you're from Swedish, and I hope you know this, but the regional lead for the North Central is Swedish Hospital. Did you know this?
Yes.
Okay. So you work with Deity and what's her name? Patrick.
Marsha?
And Marcia. Yeah. So the data, it's interesting. The data that you're looking for is slightly a different type of data, which I'm not going to ignore, like a different type of data that we as epidemiologists do. And it's interesting because I've moved into the Behavioral Health Bureau that did not have an epidemiologist for quite some time. And the data that you're talking about is more of like a programmatic data, so to say. But like the data that epidemiologists do at the health department is more health outcomes data, sort of like think of death and morbidity, like mortality and morbidity, like who's dying of things and what are people going to the emergency room and being hospitalized, people that, like opioid overdoses and traffic fatalities and things that one could better understand because you actually have the data. The other part, which is very, very important, which you asked about, is but we do have, answers to like the housing, in terms of not maybe where you could get the housing, but like a map of the folks in census tracts that have housing burden, for example, are spending more than 35% of their income on housing, right? So there are areas in the city where like you could see that, right? And then also food insecurity, right? So where are neighborhoods that do not have, supermarkets, or easily, you can't find fresh fruit or vegetables easily, right? So But what you're asking for is more of sort of the uh, finding the resources for people, right? And so a lot of the times, I said about the regional leads at Swedish is those are the people that are very connected to those communities, all of those communities in and around. And I live in Albany Park, so I live right there by Swedish, right? So they are very connected, and that is what's actually helping the health department sort of fill those gaps and know what's happening, right? So unless you're really connected to those communities, someone like Dady who might know what's going on in West Rogers Park or in places in Albany Park, they might have a food pantry. They might have some supportive housing. I know that in our neighborhood we have some new supportive affordable housing units that are going to be available shortly, right? So how would you know about that? So I I want to like put it back at you, but like be sure you could send me an email and I could reroute it, but I would probably give it to Dady or people in Swedish because that's exactly what we use the regional leads to help us sort of find out what is at the neighborhood level. Um, so I'm
Thank you.
sorry. I didn't
I
really
think,
answer your question.
yeah, we actually, I have spoke with Beatty and a few people in the health equity department. I guess what I was kind of looking for, because there are some housing relationships that I know that the department had made. I'll talk with them a little further about what they've found. But I guess maybe in the past, I've been on meetings where there were some people within the housing community, or not community, but like the people who make the policies or
Yeah.
nonprofits that they've talked about housing vouchers. And that's something that they would love to bring back, but also maybe from an epidemiological perspective, would you say that there's like one benefit over another when trying to access resources with what's the most effective way to help someone who is struggling with rent?
Yeah, I mean, that's a little tricky. I mean, um, that is, to be honest, that is the data that unfortunately we don't have at our disposal to analyze. But I understand where you're coming from. But I would please, I'm going to put my email in the chat as a part of the Healthy Chicago 2.0 and 2025 that I work with. I run the data for the social determinants, and we work with the Department of Housing with Marissa as a commissioner. And there are always different supportive housing, all kinds of ideas. So it might be something that I don't have off the, uh, I don't know right now, but I could point you into the direction somebody else that might know. So I could put my email and connect you with somebody. For housing that relates to public health, it's more of like, where are those communities that are really feeling the burden of r- um, their rent being a high percentage of their income, right? So it doesn't allow them maybe to go to the doctor, or it doesn't allow them to take care of somebody. Like it's so much that maybe somebody is not accessing mental health services because they're just worried about rent and getting that second job or third job, right? So it's like these are this sort of helps the health department understand where those communities are that have housing as a major burden, if that helps.
Yeah, that makes sense. Thank you. And I'll definitely reach out after the meeting.
Sure. Maureen, you have a question?
Yeah, well, I just wanted to kind of add to the conversation. I think this might be an excellent example of how we community health workers may approach issues, right? Like we're worried about actual clients who are coming to us in need of a resource, such as, assistance with their housing. And as I mentioned in the chat, it's unfortunate that at least in Chicago, there's many resources for food insecurity. But for housing, it's like there's, 10 years long wait lists for the vouchers. That the housing assistance does not come close to meeting the demand. So I think it's a common question, but I'm also kind of thinking about it from a little bit of a different perspective in terms of a research question of how we could maybe take data from different neighborhoods that lack affordable housing, or from different populations who, like you said, have a high rent burden, and perhaps use that data to get funding for more affordable housing, or to draw those conclusions between what you just stated, that people are spending so much of their income on rent that they can't access healthy food, or they can't pay for their health insurance, or what have you. So kind of looking at it from a slightly different lens, although that doesn't help the person who's in your office looking for an apartment, it might help in the future to get funding for those resources.
That's exactly why I did the Data Academy. That is precisely. So it's like you're helping to tell that story in a bit of a stronger way with data, in hopes that you could build a case for more funding, for more of those vouchers and all these things, that like, this is a real problem and here's the data, and these are these outcomes, right? So that's exactly why I do it. And yes, it's not the answer that we need like right today, but it's going to help. So I appreciate that. That's a good segue. So I see Sister Ya here. So we've been at the health department for a long time. So I'm glad she's here. So, there's more than just reporting health disparities. What's the message? So we have to like focus on talking about assets, but not to underscore the disparities, which are quite evident, right? When we look at addressing equity, we need to think about how we collect data, analyze data, and disseminate data. Sometimes when we talk about survey data, even like most recently, like in the polls, with the elections and stuff, but we have to think about who is answering these surveys, right? Who has the time to answer the call, potentially to be on the phone for the survey for like 40 or almost an hour, right? So we look at the respondents, and there is a higher proportion that are white, female, educated, right? So who are we missing? We're missing young Black men. We're missing a lot of Latinos, Asians, of course, Native Americans, and and so when we have this data and we share this data, we need to understand that it's not the big picture. It's not, it's wonderful data, but like we need to be thoughtful. And so when we put the RFP and figure out how we do the survey, we need to be more diligent and maybe perhaps change a survey. And we have done this recently because they've asked me to help with especially the Latino response rate. So how do we make it more accessible to folks, right? Like oversample certain areas that are Latino majority, right? And then when we have data to disseminate, is everyone getting this data, right? So we have this wonderful Chicago Health Atlas. We have we have this great like COVID dashboard. We have all these things, which I'm going to show you. But oftentimes it's the folks that already know and are connected who see these data. Northwestern, U of C, UIC, DePaul, Rush, right? We have grad students always asking for the data, but are we giving the data to the folks that really could use it, right? And so we need to make this data more accessible and more because it's for the people to tell their story. And then, like I said, we need to make sure, and someone told me recently I should change this word, empower, because it's not a great word, but we need to give the data to community members for them to tell their own story, right? And so what I do, and also what, Sister Ya does, is like we are serving the community to help them do their thing, like tell their story and what solutions do you have and how can we help get there, right? So here I have a couple more slides. I'm not going to go over all the slides. This is interesting, and I don't. So these are actual photos of community walkability projects where when you look at infrastructure changes in a lot of what transportation, I do a lot of work in transportation equity and trying to eliminate traffic fatalities is to understand neighborhoods, you have to go out and look at them and figure out how could we make things better. But sometimes, you know, some folks that I know, I know that will agree with me. We're in silos here in government and in the health department, and now we're getting out of those silos. But before, epidemiologists didn't go to communities. It's just they don't belong. They just don't. And I would argue that we have to be in communities because that's the only way we're going to understand what's going on, right? And sometimes it was like it would take too long if you involve community members because you have to wait and then you have to train them and educate them. But that's what you have to do. When you build a relationship, it's not overnight. You have to it takes months, maybe years, right? So, but when that's established, that's solid. You can't it's good, right? So, but it does take time. And so I think shifting the way we look at epidemiologists, integrating them into community, it's changing over time, but it's not something that we were trained on in school. And then sort of be the change that you want to see, right? If you're talking co-leading and bringing people in, you have to do it all the time, right? Not you have to share the data. You have to be willing to wait for folks, talk about all the things and be left on the agenda. It's fine. I learned a lot that way. And then this is that research question, basically to formulate a research question. What's your topic? What do you want to go? What's available? And what can you do? With what's available. Sometimes not everything's available, like what was said about housing and all that stuff. It's not available. So you can do the best you can with what's available. And then to answer a research question, the person, place, and time is stuff that we look at as epidemiologists. Age, gender, and race, ethnicity are sort of the go-to, and location. The smaller you get, the better. We have census tract, we have block groups, we have blocks, we have we could do half-mile radius on a school or whatever, and then the time frame. And then I talked about dissemination. That's so important, about building trust, about language that's respectful, that's honest, that's understandable. Sharing this asset-based narrative is so important, and you all know this. And using data to mobilize communities and build multi-sector partnerships. And then I put this in here because this red thing is you. You're the most important thing in this work that we do. This I shared Evan Lyon from Partners in Health. I asked him to co-lead this data academy. Now I call the Data Leadership Academy. And we really are in sync with elevating the people in the community. And he had this question, which I love, what's the best thing about your neighborhood that you want to share? So this was in the first session, and it was so cool. It was little coffee shops or little parks or little things in there. But people didn't know something from South Shore or something from Auburn. It was so cool. So I love how he just really gets he's a wonderful has a wonderful way about having people share and feel heard. This is a community spotlight that we had from the Southwest side. Arturo Carrillo, who's a PhD in social work from UIC. He is at Brighton Park Neighborhood Council. He talked about mental health equity assessment that he did is a qualitative approach. So that was super cool. People loved it. I had this woman from the Census Bureau come and talk about the census. And of course, we had some folks from from UIC because they partner with us and Metopio for the Chicago Health Atlas that you're about to see. And then I said the census, the atlas. This is I'm almost done, and then we're gonna get to learning stuff. This was really cool. Metopio, who also does a data visualization for the atlas, asked me to do a whole hour on promoting how the fellows from the Data Academy. So I had 3 of these fellows on here, and Cindy, Lucy, and Atara talk about what they gained and their perspective, and it was amazing. I can send that to you if you're interested. So these are things that I just added today. So because I'm in a different bureau now, because it's called behavioral health as of November 1st, I am a senior epidemiologist for violence prevention, mental health, and substance use. So we're going to start here because I want to start with mental health. So I wanted to, hold on here. I want to move us over here. Okay, so this is that I had on my slide, the unspoken campaign. And this is like my latest project. So I am using you all, which is exciting. So I was asked to sort of make sure we have all of the appropriate mental health providers that we can have for folks to know who is in your neighborhood. So if you want to find mental health support, so I'm just going to start with my address, which is here. So I live on Pensacola in Albany Park. So if you go here, put your address, then you could find different places to get a provider. And so right now we're in the process, I'm in charge of making sure that this information is accurate, because a lot of the information was given by another third party. Somebody else was doing it. Now it's in-house at the health department. So there might be many more people over here that we don't know about, right? And then also here at Erie, I'm not so familiar with Erie. I think it is a part of Erie Family Health Center, I think. So, and I brought this up at an internal meeting, it's really important if someone goes on there to know that if it's a not just a behavioral health provider, if it's like a primary healthcare provider, sometimes folks, you have to be inside the system to access those behavioral health components, right? So we want people to know, okay, well, in this case, you need to be a patient here, and then you could be a patient here. And then what do you need? Insurance? You don't need insurance. I mean, there's eligibility criteria. So I want folks to use this, right? I want folks to use this. Hopefully, maybe you already have. And then I want to identify some things that probably oh yeah, in this neighborhood, we have this other provider that I always, refer people to that's not on this list. We would like to know that. We have a form. I can send you that form. Then you could make sure, or you can tell me that the people in the provider, and then they would fill out the form, and then it would be on this map, right? So that is sort of that. Does anyone have a question here? No? Okay, so back to this. Okay. So then the violence reduction. I also work quite a bit on violence reduction in the Office of Violence Prevention. So this is from our violence reduction dashboard, which is another, I'm laughing because it's kind of funny. So this is another thing that was farmed out to the University of Chicago Crime Lab, now back in the city of Chicago and in our sort of lab. So I'm redesigning this, but I will show you what we have here. So this is the violence reduction, Mayor's Office of Violence Reduction. There's a strategy that was done, I think, in 2020. This is, from Mayor Lightfoot. And then, oh, sorry. Oh, goodness gracious, what happened here? Oh, okay. So that is sort of like the strategic plan. Then there's this violence reduction strategy here. So you can get some data. Hold on. Okay. So this is where I got that map that I showed you a second ago, right here, right? So you could look at, changes over time. You could highlight a community area, a ward, the police beat, police district, area, zip code, all this stuff. You could look at different crimes, vehicular hijacking, which has been up recently, homicides, fatal shootings. Select your geography, and then the victims, domestic victims, all victims, juvenile victims, right? So you could do that, and then you could look at things over time. I just thought this was interesting that here we do like changes over time, the absolute change from 2022 to 2023. You can see these numbers over here. So, and then this is looking at the actual time frame. So we see here in the darkest shaded boxes are when more of these crimes are happening here. Very late into the morning here, and also like 9, 8, and 9. Are there any questions here?
I have one
Okay.
question.
Yeah.
I don't know if you can speak to it or if you can share resources or if these resources exist. But you've talked a lot about how some data exists and some has not been collected yet. But are there any like standards or best practices when we find a data set that maybe is not exactly what we are looking for, but is similar about like kind of the science behind converting that or still using that data, even though maybe it's not exactly what you're looking for? For instance, like if you are looking for data on, let's just say, shootings amongst, those under 25, but you only have data for those like 18 to 22. Can you still use that for anything or not?
Well, so I think sometimes you can actually get what you're looking for, but you might have to ask somebody to run the data that way. For example, I'm going to show you something that, which is our data request form that I helped develop last year. Well, I'll just do that. So I'll answer your question that way. So if you want to, you go to data request form. I think. There you go. So here is this data request form. So for example, if you had a question on, because I just got this question from somebody on the South Side. You had a question on substance use and you wanted to find out, are there any opioid overdose deaths to young people less than 25 years of age? But we have that information as sort of a total, like how many happen in Chicago, but not for that younger age group. But the health department, we have that information, right? So you can submit a data request form, and then say, this is what I need. And then an epidemiologist will run the data and send it back to you. There. So this is something that I guess I could just put, I think I could probably just put it in the chat, right?
Yeah, try and drop it in the chat, but if not, you could also email me the link and
Yeah.
I'll send it afterwards.
Yeah. So I helped develop this last year. Well, actually, no, we had this on our website. Now it's a red cap survey. The way you wanted to have a vaccine clinic when we did vaccine clinics, but we've also always had this data request form, but this is like the new version of it. So if I were to just do it, then it says here, you know, are you looking for health related data? And here is the dashboard. Here is the dashboard, right? Well, what I was actually going to show you, because you guys, I think everyone's seen this dashboard, right? Yes. Is there anyone raise hands that wants me to like briefly look at the dashboard? Oh, was that a thumbs up or a yes? Angelica, a yes? So I will briefly, it's just kind of a phenomenal COVID dashboard that, you know, the health department did during COVID. And it was really pushing out what people wanted to know. So of course, like, you know, laboratory confirmed cases, hospitalizations, deaths, vaccinations administered, emergency room visits, and hospital beds in use. Those were like a lot of this like forward facing information that shape the way we are in high, medium, and low. And like if we're going to do like this like stay at home order and then wearing masks and all that other stuff. So these are these indicators that drove those decisions. But besides that, we have like a deeper dive into like wastewater surveillance, right? You can look at where these sites are that are collecting this information, and, you know, all over the country, all this stuff. And there's reports about it, right? And then there's the variance. The variances change over time, right? So we have like right now, the variant of concern, the variant right now of interest is this XBB 1.5, which is most of the cases, right? And so we can look all over the country, right? So this is what I go to. This is my go-to for COVID vaccine coverage, which is what I was doing as part of like this weekly. And I know that Maureen, you saw this all every single week, that I was looking at coverage by race, ethnicity, by age group. This was the most favorite thing that people wanted to look at. And not just looking at the age groups, like at least one dose, complete series, and the bivalent booster coverages by race, ethnicity. But what I did was I started doing it by, by race, ethnicity. So like 5 to 11-year-olds. So this is all 5 to 11-year-olds. So we can see here that the white non-Latinx has the highest coverage for 5 to 11-year-olds for at least one dose, complete series, and updated bivalent booster. If you really think about this, for 5 to 11 years old, they had the bivalent booster, I think, available to them, because I have 3 5 to 11-year-olds in that age group. I believe in November, I think, is when they got their October, November is when they got the booster. Citywide, only 9% of 5 to 11-year-olds have had the booster. That's it. Double that in the white, and then almost double that in Asians. And then for Blacks, it's 3%. Latinx is 8%, right? If you look at this, only 3% of all these kids under 5. High 6%. Even this, you know, at least one dose, only 19% of these kids under 5, right? But even when you look at 65 years old, only 42% of seniors have had a booster. So this is for me, yes.
I just have a question. So I'm a data nerd. So this
Tell me.
gets like, I love, I love understanding all of this. But I just wonder, like, as we're all thinking about using this in the community, Margarita, what your thoughts are. Like, I can see right away, okay, grant funding, like this would, a lot of the things you've showed would be so powerful for grant funding. But I'm just wondering, like, in terms of getting the data into the community is important for sure. But do you have thoughts about how we like mobilize people or how we respond to, from a community perspective,
Yes.
some of these data trends that you're sharing that are really concerning, right? Like they do empower me to want to take action. And then I'm like, well, I can write a grant, but what else can I do? You know,
I
so
have
don't know what your
many,
thoughts are, but I'd
many,
love to hear your
many
ruminatings
ideas,
on that a little bit.
many ideas. And I think, for one, this group is amazing because it's a community health worker group, right? And you guys are awesome. And I mean, you guys have been doing this work for so long, but even during COVID is where like you're like, oh, community health workers, they might help us get the vaccine message out. Like, hello, right? Like navigators, and like, so that drew like a lot of folks to actually, we fund, community health workers, like, what's it called? Like consultants or whatever. Maybe not like at the city of Chicago, but we actually do a lot of work with community health workers, right? So that's one part where I would love, we can continue on and to provide training to your people. Like even this, like if you're centered at vaccine or, obesity, I'm like anything you want, we could tailor it that all the folks in your agency know what the data is. Like, you know what I mean? Like, what are the questions that people have, like to better understand what is really going on. The other, so the community health workers is a big, huge group. The other ones are like families, like parents. I was a local school council representative, right? LSC representative during COVID at my daughter's school, and as an epidemiologist, right? So I would actually give like these presentations that I gave to Maureen in the CVP to this people like in LSC, and they're like, oh my God, this is fascinating. Oh my gosh, I didn't realize that these kids aren't vaccinated. And like, oh, because really what it means is we lost a lot of time for folks actually going to their medical providers. Some of us, like even me, I'm going to confess, I was too busy doing the Data Academy and I missed my annual thing with my doctor. Like I didn't go. I was like, oh yeah, I'll reschedule it. And I didn't. So I went and I was like, blah, blah, blah. She's like, oh yeah, you didn't come last. I'm like, oh, right. The mammogram, the this and that. Right. So it happened to so many people, right? So many people didn't go to do sort of like that preventive care, right? There was a lot of kids that are way behind in their vaccines. Now I'm not even talking about COVID, like just their regular, vaccines. And, talk about dental health, you talk about like there's like so much, right? So I think families who are trusting of their educational place that they take their kids to, they trust them, right? So really honing in on that and educating those parents, letting them know exactly who was it? Nita, right? Asked me about housing. People need to know where to go get this stuff. Like where? You know what I mean? They need to know, right? So where to get the vaccines, where to get the test for COVID, where to get tell me about the treatment, tell me what I need to ask. Like people need to know, right? And I think we often assume, I'm talking about public health. Public health assumes that people are just going to go ask their doctor. That is just not what everyone does. Some folks don't have a physician, right? Some folks don't have insurance. And some folks are on Medicaid, but haven't chosen a provider, or like they're just like, it's too costly or to schedule it takes 3 months. And I don't know, like, it's just like, it's not a reality, right? So where could I go to get the needs met and to do that, right? But then apart from that, which I talked about, like that the really important part is like the trust. If you don't trust the provider, or you're not going to go, or their doctor be like, oh yeah, we have vaccines, are you interested? Oh no, I just heard that there's like this weird thing and there's some real chip thing, and I don't like it's not really like that is a reality for folks, right? And some physicians and nurses and nurse practitioners and or community health workers have said to me, like, Margarita, I've talked at length and people don't trust. We just have to keep on trying, because there's going to be something that's going to come later. You know what I mean? You have to keep on. So all of this stuff. So I say, you all community health workers, parents, families, the avenues where people are already at, schools, libraries, park districts, things that are where people are at, lavanderias, where people go wash their clothes. We did a lot of work with doing vaccines to lavanderias on the southwest side, the south side, right? So we have to think about engaging people who we don't think are partners, right? Like restaurant workers, like, and everyone, and so I'm sure there's a lot of other people that I haven't talked about, right? So there's just people who are not going. Think about the people who are not going to their doctors. Who are those people, and where are they at? Like, you know yeah. And then of course, like young people, you have to message it. It was challenging with like getting the vaccine to young people, especially when the vaccine was available for young people, but then their parents didn't want the vaccine. So like educating that young person who's 12 or 13, but then whose parent does not want to sign the paper. That was a little tricky, right? So, but sometimes it was the other way around. Sometimes a young person would actually convince their parents, like, hey, this is good. I found out this stuff at my school, and like let's read about it together. Like let's get our questions answered, right? So that was really cool. And that happened. So there's so many avenues that it's all about like, building the community and trust. That for me, that's what it's all about. And nothing is like any idea is good. Like if someone gives me idea about like talking to, I don't know, CTA, worker, I mean, like whatever, like it's good, right? No one is like, everyone should be involved in anything, the vaccine, violence prevention, mental health. It's never too young to talk about your emotions to a 3-year-old, right? As long as you can talk, right? About how to communicate with someone, not throw things or kick them, like, like it's never too young, right? So, like the social media is all like the whole thing, right? So, but mental health, the opioid overdoses. I work in this behavioral health, and I'm going to talk about this in a second. But the Narcan, so we could like stop, like prevent a death of someone who is overdosing with opioids. I mean, this is actually, people are saving people's lives, like, and it's a real thing. They are in all of the Chicago public libraries, all of them. Now they want them to be in the park districts. Now they want them to be in churches. I mean, like everywhere, right? So it's about like connecting people. Yeah, the faith community, that's another community that is, we readily work on with violence prevention, with opioid, substance use. It's all about like reaching to people where they're at. So I hope I answer your question.
Sorry to interrupt. I just wanted to make sure we have about 5 minutes left. So I just kind of wanted to make sure if anyone else had a pressing question for Margarita.
I just want to do one. I think I have one last. I think I'm almost done. This is my last slide. So this is from opiate overdoses, and pardon me, this is a little dated, but we're still working on our most recent report. But this came out at the end of 2019, You see here, because this is very telling, this is the opioid-related EMS runs, so ambulance runs by quarter from 2013 to 2019. It went from 410, now it's much higher, all the way to 2730 in this like third quarter of 2019. This is it's a huge problem right now, right? And this is a map of these EMS runs in 2019. So we see here on the west side is where we have a lot of in Austin, over 1,300. West Godfrey Park, Humboldt Park. And I think this is my last slide. So this is my email and my phone number. And it is a joy. I love like my most favorite part of my work is actually, you know, meeting people, and just please don't hesitate to email or call or anything. If I can't answer your question, I will make sure that somebody can.
Thank you so
Sure.
much. This was a great presentation. If you send on the slides and the data request form to me, I'll make sure to share that with folks. There were a couple of people specifically in the chat who had to leave early but wanted to connect with you. So definitely share that with me and I'll get it out. I also want to remind everyone in the audience, if you have flyers or announcements or events you want to share, email that to me and I'll share it with the group. And save the date for our April session, which will be April 26th at 12 p.m. Central Time. And we'll discuss community organizing and advocacy in the disabled communities. So we'll have some community organizers from Access Living, and they'll be discussing sort of their work and how community organizing intersects with community health. So thank you, everyone.